What's going on, everyone? Welcome back to the channel, and thank you for clicking on this video. For those who may be new to the channel, my name is Terence, and I'm a first-year medical student. If you're new, make sure you subscribe and like the video if you enjoy these videos. I'll be putting out weekly videos just like this, so make sure you subscribe and come along for the journey. Today, I have a very special guest on my channel. We're continuing the interview series. I have Kristian Enriquez, BSN RN. He is a good friend of mine. We've been friends ever since high school basketball, high school English class in 9th grade. We've built a relationship over the years. We both have a passion for medicine. He is a nurse, an RN. He's an orthopedic nurse right now, but he was also a nurse on the Med Surg floor at Stony Brook University Hospital. So I'm gonna have him introduce himself. Chris, thank you so much for coming on the channel, and just let the people know who you are and tell us a little bit about yourself.
Pleasure, bro. So name's Kristian. Did my undergrad at Stony Brook University for 2 years, applied, got into the nursing program. Before that, was doing a little medical assistant work, got into the program, graduated from Stony Brook 2014, ended up getting a job there at the hospital as a Med Surg tele-nurse. Worked there about a year and a half, all the way to the end of COVID. Took a little month-long break, and then right now, working at Hospital for Special Surgery in New York City as an orthopedic nurse.
Excellent. So you talked about your different experiences, and you've accumulated a lot of different perspectives, I guess, over the years, going from med surg to ortho. How would you describe your day-to-day as med surg, and how would you compare that to your day-to-day now as orthopedics?
I think the biggest thing is like assessment is like you always got to be on your game. You got to still always expect the unexpected. I think is like what I always tell like my new nurses is like you always got to be ready for like things to go south. But I feel like on Med Surg it was different. Like you had the whole variety of everything. You had like your UTIs, your pneumonias, you had the basic stuff, but you also throw in the confusion element, which I was like always a part of. We're like now in ortho, elective surgery, everyone there wants to be there. You're not looking at long-term stays of like 2 weeks, 3 weeks. You're looking at 3-4 day turnarounds of people who know what they want and they want to get the hell out. But I feel like it's two totally different worlds where you got the sick, and you got people you just need to get in and out of the hospital.
So from your experience, so can you explain a little bit more about your med surg floor, just for those that are unaware about how, the different floors of the hospital work? What kind of patients did you typically see with med surg?
Yeah, so like in the hospital, at least at Stony Brook, they have the ICU, one nurse to 2 patients, the sickest of the sick, literally on the fence, anything could happen. You come down, ICU step down, you're looking 1 nurse to like 3-4 patients, depending on the day, depending on staffing. And then if you're sick, what I tell everyone is you're sick enough to be in the hospital, you end up on a med surg floor, looking at 1 nurse to like 5-6 patients, depending on the staffing. So you go anything from like 20-year-olds who maybe ETOH abuse, alcohol abuse, or someone that overdosed on drugs and they're coming down from the ICU, or, someone just with like a gallstone, a kidney stone, stomach pain, anything like that, where you're not acutely, for the most part, gonna go either way, but you're sick enough to be in the hospital, you'll end up on like a med surg floor.
So you're seeing everybody. You're seeing everybody essentially, and you're getting, like I said, different perspectives on what's going on. Do you feel like that helped prepare you, or do you think that now that you're doing orthopedics and it's more acute treatment or post-operative treatment in that way, do you feel like med surg really prepared you and now your life is a little bit easier? Is there some things that you miss about med surg?
I'd like, me personally, I feel like every nurse has to like start in like that med surg world. Like it's the biggest thing about nursing is like time management. And when you have 6 different patients for all 6 different kinds of diseases, illnesses, different medical backgrounds, you have to be able to know what's important for each of your patients and what's different for each of your patients. You might have your full coder in the same bed as someone that's your DNR, DNI. And if anything was to happen, you kind of got to know the difference.
Right.
So I feel like it's just such a big deal of like time management, organization, where like med surg is just so key in that, where you get literally everything. and
Right.
like anything you would imagine, you probably have seen.
Interesting. So you kind of talked about those skills of time management, skills with just balancing everything. On the topic of skills, do you feel like nurses have that unique skill of kind of juggling behind the scenes that maybe other healthcare professionals don't have to utilize as much? Or is there any particular skill that you feel that nurses have that kind of allow them to be, or kind of allow everybody to be on their best, best behavior?
Well, I think nursing, definitely the time management is like the biggest thing, but I also feel like critical thinking, where, shout out to all the physicians, but like I feel like you guys treat the illnesses because you guys don't have you literally don't have the time to
Right.
spend with patients because you have like 50 to 60 in a night. You know what I mean? I have 6. I have time to look at every little detail and pass that along to you guys. Like you might see a patient at the beginning of shift and at the end of your shift. I'm with them 12 hours where I have to be able to pick up on the little assessment changes, the little meaningful changes in vital signs, the little changes in mental status that just might be enough to kind of catch it early and then get it to you guys to really fix the problem, like get the orders going.
Mm-hmm. So it seems like it's like another, and this is interesting to hear from you because I don't think we've ever like had this conversation. It's just thinking about the level of detail, right? Like we don't talk about medical stuff outside of really our own perspective because we have other interests and other things that we relate to. But just think about the next level. Like you think about levels of detail, right? You think that physicians, you think about, all right, as a physician, you have to be super detail oriented. You see somebody for a short period of time, you have to kind of absorb as much detail as you can in that time. But then you go to the next level where it's like, okay, longitudinal care. That's where the nurses are. They're filling in the little details every step of the way. And those are things that I feel like a lot of pre-meds probably overlook. Unfortunately, you hear sometimes people diminishing the positions of others in the hierarchy. And that's, one of the reasons I love having these conversations is because you hear about all the details that every little individual stepping stone in the healthcare system allows for optimal care. So I love hearing that. And I was always told, appreciate your nurses, appreciate your MAs,
That's right.
show love to
That's
them
right.
because those are the little things that you don't think about until you have a conversation with somebody. It's like, well, who's going to fill you in when you're not there? Who's going to fill you in when you're taking care of 50 other people? So that's beautiful to hear. So thank you for sharing that. Last,
like always, that's something I always tell you is like, yo, be good to your nurses because at the end of the day, their clinic, there's probably been a nurse that's been like 10, 15 years. Mm-hmm. Like, I don't care if they don't put the orders in, they've seen it. And like, they're going to be the ones to help you through it where like, you don't want to run to your attending yet. You can talk to your nurses. Like, we're not telling you to put the orders in because you're the one who clicks the button at the end of the day. But like, we can help you. And like, I've seen this before. Just try this kind of thing. And you don't have to run to your attending every time. You got other people that can help you kind of thing.
I think it's so important because, and this kind of goes into the last question I want to ask you. I think it's so important, and I never even thought about it in that way because I guess when we're medical students, like we just want like to impress our attendings, right? We want to get that letter of recommendation. We want to get that grade that's going to help us get into residency, right? So we're just always trying to impress attending. We're trying to go to our attendings, kind of kiss up to them, right? It makes sense now. If I were to be a medical student and I'm like playing it low key, everybody's running to the attending, I'm playing it low key and hitting up the nurses, I'm building relationships with other people. I'm going to look way smarter if I go to my attendings because I'm going to actually know what I'm talking about because I actually did my due diligence by talking to these people and understanding the full scope of things. So is there any advice that you would have for, I guess, either future medical students, pre-meds right now, perspective on how, they could interact with nurses to improve, healthcare overall?
Yeah, I think the biggest thing is like, yes, you guys are the doctors and we're the nurses. Like, I get it. There's that difference. But at the same time, it's like, at the end of the day, it's like patient care. Patient care, patient care, patient care. So, like, let's just work as a team and, like, get it done where it's okay to, like, literally say, like, I don't know. Like, let me ask. Like, tell your patients, like, I don't know. Let me find out. Let me ask the attending. Let me ask someone who knows better. So like I think for like nurses and doctors specifically, like let's not look at like I'm above you, you're above me. Like let's kind of like work on like an even plane. Same thing with like nurses and nursing assistants, where I could do the same thing you do. I could take vitals, I could change a patient, I could change a bed. Yes, like that is your job, whatever. But if I'm free, I can do that.
Right.
Same thing with like doctors. Like just talk to your nurses. Like you're not. Yes, you guys make more money than us. Yes, you guys are above us. But like, doesn't necessarily mean you're better than us.
Right. No,
But
100%.
like, you guys put the orders in. But like, experience. I feel like experience weighs more than educational background.
Mm-hmm.
Listen to like your nurses. Listen to your people that have like been there. But you got to establish that like rapport. Like as much as you got to establish rapport with patients, you got to establish that with nurses. Same thing with nurses. Like you got to be able to find your doctors you trust, and you got to earn the trust of your doctors. You don't just get it in the hospital. You got to make sure you earn like your stripes.
Dude, that's beautiful. That's beautifully said. I'm gonna soak that all in, and then and utilize it in the future, because I can already see the dynamics unfolding before me in front of, with different people I go to school with. I'm sure that they're going to feel and utilize that hierarchy to their advantage. But in reality, the best way to utilize and the best way to take advantage of the hierarchy is to eliminate it altogether and collaborate. So that's so well said. I want to thank you for coming on, having this conversation. Maybe we'll have you back on the show another time. But I want to thank you for coming on. I'm looking forward to catching up. We haven't actually seen each other in a long time, so we're going to definitely catch up next time. You'll come out to Philly, or I'll whenever I'm back in New York. So
when I move out, I got you.
Yeah, exactly.
When I'm officially a city boy, I got you.
Exactly. Well, thank you again. I want to thank everybody for watching. Be sure to subscribe if you're new. Like the video if you enjoy these videos. Putting out weekly videos just like this every single week. Good luck to everybody out there. If you're a nursing student, thank you for tuning in. If you're a medical student, make sure you take care of your nurses, and let's get it.